If you're over 60, your liver may be quietly sending warning signs long before pain ever appears, and most people completely miss them. That's what makes liver damage so dangerous. By the time obvious symptoms develop, the damage may already be significant. Today, we're uncovering the subtle signals your body may be using to ask for help, including one surprising symptom that often appears months before people realize their liver is struggling. Stay with me, because the final warning sign is one that many seniors mistakenly blame on aging. The liver is one of the hardest working organs in the human body. It filters toxins, regulates blood sugar, helps digest fats, stores nutrients, and produces proteins your body needs to survive. The remarkable part is that it can continue functioning even when a large portion has already been damaged. That silent resilience is exactly why liver disease often goes unnoticed in its early stages. Many people expect liver problems to cause severe pain, but that's rarely how the story begins. Instead, you may notice persistent fatigue that doesn't improve with rest. You wake up tired, lose motivation during the day, and assume you're simply getting older. Research has shown that chronic liver disease can interfere with normal energy metabolism and increase inflammation throughout the body, leaving you exhausted long before other symptoms appear. Another early clue may be unexpected changes in your appetite or digestion. You may feel full after only a few bites, experience frequent bloating, or notice nausea that seems to come and go without explanation. Because the liver plays a central role in processing nutrients and producing bile, even mild dysfunction can disrupt digestion in ways that seem unrelated at first. But there's another symptom many families overlook that may be even more concerning. Have you noticed increasing forgetfulness, difficulty concentrating, or feeling mentally foggy? While memory changes have many possible causes, advanced liver dysfunction can allow certain waste products, including ammonia, to build up in the bloodstream. These substances may affect normal brain function, leading to confusion or slowed thinking. It's important to remember that these symptoms are not specific to liver disease and should always be evaluated by a healthcare professional, but they should never be ignored. Your skin may also reveal valuable clues. Persistent itching without a visible rash, yellowing of the eyes or skin, or bruising more easily than before can sometimes reflect changes in liver function. These symptoms occur because the liver helps process bilirubin and produces proteins involved in normal blood clotting. If these warning signs appear, seeking prompt medical evaluation can make a meaningful difference. Some people also notice swelling in the legs, ankles, or abdomen. While heart disease, kidney disease, and many other conditions can cause swelling, liver disease is another important possibility. When the liver becomes damaged, changes in blood flow and protein production can allow fluid to accumulate in the body. This is never something to dismiss as simply getting older. The encouraging news is that early liver disease can often be managed more effectively when it's identified before permanent damage develops. Regular medical checkups, appropriate blood tests, maintaining a healthy weight, limiting alcohol, staying physically active, controlling diabetes, and discussing all medications and supplements with your healthcare provider can all support liver health. Never stop or start medications without professional guidance, but don't wait for severe symptoms before asking questions. If you're over 60, remember this: your liver rarely shouts for attention, it whispers. Those whispers may be fatigue, digestive changes, brain fog, itching, swelling, or subtle changes that seem easy to explain away. Listening to those signals and getting evaluated early could help protect not only your liver, but your overall health and quality of life. That vague feeling that something has changed is often where the story begins. Many people ignore it because there isn't one dramatic symptom demanding attention. Instead, small changes quietly accumulate until they begin interfering with everyday life. One of the next warning signs frequently appears during meals, but because it develops gradually, it's easy to overlook. You may notice that you're getting full much faster than you used to. Foods you once enjoyed suddenly seem less appealing. You might push your plate away halfway through dinner without realizing why, or you may experience bloating after eating only a modest amount. These changes are often blamed on aging, but they can also reflect changes in how the liver supports digestion. The liver produces bile, a substance that helps break down dietary fats and allows your body to absorb important fat-soluble vitamins. When liver function becomes impaired, digestion may become less efficient. Although many digestive problems have causes unrelated to the liver, persistent bloating, nausea, loss of appetite, or unexplained discomfort after meals deserve a proper medical evaluation, especially if they continue for weeks. These symptoms don't automatically mean liver disease, but they should never be dismissed simply because you're getting older. Something else may begin happening around the same time. The number on the scale starts changing without any clear explanation. Some people gradually lose weight because they simply don't feel like eating anymore. Others gain weight around the abdomen, even though their eating habits haven't changed significantly. Excess abdominal fat is closely associated with metabolic dysfunction, and over the past 2 decades, physicians have become increasingly concerned about a condition known as metabolic dysfunction-associated steatotic liver disease, previously called non-alcoholic fatty liver disease. It has become one of the most common liver disorders in the United States, affecting millions of adults, many of whom have no idea it's developing. One of the biggest misconceptions about liver disease is that it only affects people who drink excessive amounts of alcohol. That belief has prevented countless individuals from recognizing their own risk. Today, many liver specialists see patients who rarely drink or never drink at all. Instead, factors such as obesity, type 2 diabetes, elevated cholesterol, insulin resistance, high blood pressure, and sedentary lifestyles are driving a growing number of liver-related illnesses. This is why routine health screenings have become so important after age 60. By the time symptoms become obvious, significant inflammation or scarring may already be present. Now, here's something many viewers don't expect. The liver doesn't just influence digestion. It also plays a major role in regulating blood sugar. Every time you eat, your liver helps store excess glucose and releases it later when your body needs energy. If this system becomes less efficient, blood sugar regulation may become unstable. Some people notice unusual hunger between meals, while others feel shaky, weak, or mentally sluggish if they go too long without eating. Although these symptoms have many possible explanations, the liver's role in maintaining metabolic balance is often overlooked. Speaking of mental sluggishness, this brings us to one of the most misunderstood warning signs of all. Have you ever walked into a room and forgotten why you were there, misplaced your keys more often, struggled to remember a familiar name that should have come instantly? Mild forgetfulness can certainly occur with age, and many conditions can contribute to memory changes, including poor sleep, medications, depression, thyroid disorders, and vitamin deficiencies. However, advanced liver dysfunction can also affect the brain through a condition known as hepatic encephalopathy. Here's the simple explanation. Under normal circumstances, your liver filters waste products that naturally form during digestion and metabolism. One of these waste products is ammonia. A healthy liver converts ammonia into substances the body can safely eliminate. But when liver function becomes severely impaired, ammonia and other toxins may begin accumulating in the bloodstream. These substances can eventually reach the brain, interfering with normal communication between brain cells. People may experience confusion, slower thinking, personality changes, difficulty concentrating, or unusual sleep patterns. These symptoms generally occur in more advanced liver disease rather than the earliest stages, but understanding this connection highlights just how closely the liver and brain work together. Scientists continue studying the complex relationship between liver health and brain function. Researchers believe inflammation, changes in gut bacteria, altered blood flow, and the accumulation of metabolic waste products all contribute to these neurological effects. While these symptoms should never be used to diagnose liver disease on their own, they reinforce an important message. The liver doesn't work in isolation. When it struggles, the effects can ripple throughout nearly every system in the body. There's another clue that often appears long before people suspect anything is wrong, and unlike fatigue or digestive changes, this one is visible. In fact, family members sometimes notice it before the person experiencing it does. It may start with the skin, the eyes, or even small changes that seem cosmetic, rather than medical. Many people spend months treating the symptom itself without realizing the real problem may be much deeper, and one particular skin change has prompted countless patients to schedule a doctor's appointment just in time for early diagnosis. We'll uncover that next because recognizing it early could make all the difference. One of the remarkable things about the human body is that it often reveals what's happening inside long before medical tests are performed. The skin, the eyes, the nails, and even the color of your urine can sometimes provide important clues that deserve attention. While none of these signs automatically mean liver disease, recognizing them early and discussing them with your healthcare provider can lead to earlier testing and, in many cases, better outcomes. The challenge is that many of these changes develop so gradually that they seem almost invisible until someone points them out. Perhaps the best-known warning sign is yellowing of the skin or the whites of the eyes, a condition known as jaundice. This happens when bilirubin, a yellow pigment produced during the normal breakdown of red blood cells, builds up in the bloodstream because the liver is no longer processing it efficiently. Jaundice is not usually an early symptom of mild liver disease, but when it appears, it should always be evaluated promptly. Many people first notice the change in natural daylight or when looking at photographs, while family members may recognize it before the individual does. Long before jaundice develops, however, some people experience persistent itching that seems impossible to explain. There may be no rash, no insect bites, and no obvious allergic reaction, yet the itching continues day after day. Scientists believe that in certain liver disorders, changes in bile flow and the accumulation of substances in the bloodstream may stimulate nerve endings in the skin, producing intense itching. Because dry skin becomes more common with age, this symptom is frequently treated with lotions alone, while the underlying cause remains undetected. Another overlooked clue involves bruising. Have you noticed that small bumps seem to leave larger bruises than they once did? The liver produces several proteins that help blood clot normally. When liver function becomes significantly impaired, production of these proteins may decline, making bruising or prolonged bleeding more noticeable. Of course, blood-thinning medications, aging skin, and many other medical conditions can also contribute, which is why these changes should always be interpreted by a healthcare professional rather than used for self-diagnosis. Pay close attention to swelling in your feet, ankles, or lower legs. Many people assume swollen ankles are simply part of growing older or standing too long, but persistent swelling deserves careful evaluation. The liver helps produce albumin, a protein that keeps fluid inside blood vessels. When albumin levels become too low because of advanced liver disease, fluid can begin leaking into surrounding tissues. In other cases, increased pressure within the liver's blood vessels, known as portal hypertension, may contribute to fluid buildup in the abdomen, a condition called ascites. These are signs of more advanced liver disease and require prompt medical attention. Here's another symptom that often surprises people. Changes in urine or stool color can sometimes provide valuable information about liver function. Dark-colored urine or unusually pale stools may occur when bilirubin and bile are not being processed normally. Although dehydration, medications, and other illnesses can also change urine color, persistent changes should never be ignored, especially when accompanied by fatigue, itching, abdominal swelling, or yellowing of the eyes. Now let's talk about something many people never connect to liver health: muscle loss. Beginning around age 60, it's common to lose muscle gradually, a process called sarcopenia, but chronic liver disease can accelerate this decline. When the liver struggles to process nutrients and regulate metabolism efficiently, the body may begin breaking down muscle tissue more rapidly. You may notice weaker grip strength, difficulty climbing stairs, slower walking speed, or greater difficulty carrying groceries. These changes are often blamed entirely on aging, yet they may signal that your body is dealing with more than the normal passage of time. Researchers have also found that poor liver health is closely linked with chronic inflammation and metabolic dysfunction, both of which affect the entire body. This is one reason physicians increasingly emphasize maintaining muscle mass through regular physical activity and adequate protein intake when medically appropriate. Healthy muscles improve blood sugar regulation, support mobility, and may reduce some of the metabolic stress placed on the liver. Perhaps one of the most dangerous mistakes people make is waiting for pain before taking action. Unlike the heart during a heart attack or the kidneys during a kidney stone, the liver often remains remarkably quiet. Many patients diagnosed with significant liver disease later say the same thing. I never felt pain, so I thought everything was fine. Unfortunately, silence does not mean safety. It often means the disease has been progressing without attracting attention. The encouraging news is that modern medicine has made tremendous progress in identifying liver disease earlier than ever before. Routine blood tests can detect abnormal liver enzymes. Imaging studies such as ultrasound can identify excess fat or structural changes, and additional testing can help determine the underlying cause. Early detection provides the greatest opportunity to slow progression, treat contributing conditions, and reduce the risk of serious complications. But there's one final piece of the puzzle that many people overlook completely. It isn't a symptom you can feel immediately. Instead, it's hidden in everyday habits that slowly increase liver damage year after year without causing obvious discomfort. Millions of older adults unknowingly repeat these habits every single day, believing they're harmless. In the final part, we'll uncover those hidden risk factors, explain what you can do to better protect your liver, and discuss why the choices you make this week could influence your health for years to come. If you've stayed with me this far, you've already learned something that many people don't discover until after a serious diagnosis. Liver disease rarely begins with dramatic symptoms. Instead, it develops quietly, influenced by everyday habits that may seem harmless on the surface. That's why understanding these hidden risk factors is just as important as recognizing the warning signs themselves. The goal isn't to create fear, it's to help you recognize problems early enough to do something about them. One of the biggest threats to liver health today isn't always alcohol. In fact, many older adults diagnosed with fatty liver disease drink very little or no alcohol at all. Instead, excess body weight, especially around the abdomen, insulin resistance, type 2 diabetes, high cholesterol, high blood pressure, and physical inactivity have become major drivers of chronic liver disease. These conditions often occur together as part of metabolic syndrome, placing continuous stress on the liver for years before noticeable symptoms appear. Another factor that deserves attention is medication use. As we age, it's common to take several prescription medications, along with over-the-counter pain relievers, herbal supplements, and vitamins. Most medications are safe when used correctly, but nearly all of them must be processed by the liver. Taking more than the recommended dose of certain medicines, combining medications without medical guidance, or using unregulated supplements can increase the workload placed on the liver. That's why it's important to review every medication and supplement with your healthcare provider or pharmacist, especially after age 60. Your diet also plays a powerful role. Diets high in added sugars, refined carbohydrates, and highly processed foods can contribute to excess fat accumulation in the liver over time. Sugar-sweetened beverages, frequent desserts, and heavily processed snacks may seem unrelated to liver health, but excess fructose and excess calories can promote fat storage inside liver cells. On the other hand, research suggests that eating more vegetables, fruits, legumes, whole grains, healthy fats, and lean sources of protein, while limiting highly processed foods, can support overall metabolic health and reduce the risk of fatty liver disease. Regular physical activity is another powerful tool. You don't need to become a marathon runner to benefit your liver. Even moderate activities such as brisk walking, swimming, cycling, gardening, or strength training several times each week can improve insulin sensitivity, help reduce excess liver fat, preserve muscle mass, and support cardiovascular health. For many older adults, consistency matters far more than intensity. Small, sustainable habits practiced over months and years often produce the greatest long-term benefits. Sleep is another piece of the puzzle that many people underestimate. Poor sleep has been associated with increased inflammation, impaired glucose regulation, weight gain, and metabolic dysfunction, all of which may indirectly affect liver health. If you're consistently sleeping poorly, snoring heavily, or waking up feeling unrefreshed, Discussing these concerns with your healthcare provider may benefit not only your energy levels, but your overall health as well. Perhaps the most important message is this: don't wait for severe symptoms before scheduling an evaluation. Routine medical checkups, recommended blood work, and appropriate imaging studies, when indicated, can identify liver problems long before irreversible damage develops. Early detection allows healthcare professionals to investigate the cause, recommend lifestyle changes, treat underlying conditions when appropriate, and monitor progression over time. Many forms of liver disease respond much better when discovered early rather than after complications develop. It's equally important to remember that the symptoms discussed today are not specific to liver disease alone. Fatigue, digestive changes, memory concerns, itching, swelling, and appetite changes can also result from heart disease, kidney disease, thyroid disorders, medication side effects, vitamin deficiencies, infections, and many other medical conditions. That's exactly why self-diagnosis can be risky. If you've noticed persistent changes in your health, the safest step is to speak with a qualified healthcare professional who can perform the appropriate evaluation. Imagine where your health could be 1 year from now. One path is continuing to ignore the small signals your body may be sending, hoping they'll simply disappear. The other path begins with paying attention, asking questions, scheduling preventive care, and making small daily choices that support your health. Those choices may seem insignificant today, but over months and years they can make an extraordinary difference in maintaining independence, mobility, and quality of life. Your liver works for you every second of every day without asking for recognition. It quietly filters your blood, processes nutrients, supports your immune system, helps regulate metabolism, and performs hundreds of essential tasks that keep you alive. The least we can do is give it the attention it deserves before problems become serious. Remember, successful aging isn't about avoiding every illness. It's about recognizing potential problems early, making informed decisions, and working together with your healthcare team to protect your long-term health. Now I'd like to hear from you. Have you experienced any of the warning signs we discussed today, or did one symptom surprise you the most? Share your thoughts in the comments below, because your story may encourage someone else to seek medical advice before a small problem becomes a much bigger one. If you found this video helpful, consider sharing it with a friend or family member over 60 who may benefit from this information. And if you're interested in more evidence-based videos about healthy aging, brain health, heart health, nutrition, and the latest medical research explained in clear, practical language, subscribe and turn on notifications so you never miss an important update. Your future health is shaped by the choices you make today, and taking the first step may be one of the best investments you'll ever make.